2,500 years ago, someone walked into an Etruscan workshop with missing teeth and walked out with a gold dental bridge. Modern dentists examined it. They could not figure out how it was made. After a century of mystery, scientists finally cracked the code. In 1885, archaeologists opened an Etruscan tomb in central Italy and found something that should not exist. Among the bones lay a set of teeth, but not natural ones. These were replacement teeth, bound together with gold wires so delicate, so precisely fitted, that the Victorian scientists refused to believe it. They declared it a forgery. How could a civilization without microscopes, without steel instruments, without any of our modern tools, create dental work this advanced? That question haunted archaeology for over 100 years. And here is where our investigation begins. Because what they found in that tomb was just the first piece of a puzzle that would eventually rewrite the history of medicine itself. The Etruscans left behind evidence of something remarkable, something that challenges everything we thought we knew about ancient capabilities. Before we decode the dental mystery, you need to understand who the Etruscans actually were. They dominated central Italy from around 800 BCE until Rome absorbed them 3 centuries later. And here is what most people miss. The Etruscans were not primitive. They built the first sewage systems in Italy. They pioneered bronze metallurgy that influenced Greek craftsmen. They developed a written language we still cannot fully translate. But their medical knowledge, that remained hidden until those tomb discoveries began surfacing. Over the next century, archaeologists found not 1, not 5, but dozens of these gold dental appliances scattered across Etruscan burial sites. And each one revealed the same disturbing truth. If this is already challenging what you learned in history class, that like button lets me know to keep digging deeper. Because the craftsmanship only gets more impossible from here. Now let me show you exactly what we are dealing with. Imagine you are a modern dentist, and someone hands you one of these artifacts. The first thing you notice is the gold. But here is where it gets strange. This is not solid gold. The Etruscans used pure gold wire, hammered into flat bands less than half a millimeter thick. They wrapped these bands around existing healthy teeth, creating anchor points. Then they attached replacement teeth, either human teeth from donors or carved from ox bone, into the gaps. The precision of these bands is what baffled scientists. To fit this snugly around a tooth without damaging it requires understanding something fundamental about dental anatomy that we assumed was a modern discovery. The margin of error is microscopic. Too tight, and the anchor teeth die. Too loose, and the prosthetic falls out. Yet these appliances show where patterns indicating years, sometimes decades, of daily use. But wait. We have not addressed the elephant in the room. How did they extract the damaged teeth in the first place? This is where the investigation takes a darker turn. The Etruscans performed dental extractions without anesthesia, without antibiotics, without any of the safeguards we consider essential. And yet, skeletal evidence shows remarkably low infection rates. Archaeologists found specialized bronze tools in medical kits buried with presumed healers. Thin probes for cleaning cavities. Hooked instruments for extraction. Tiny scoops that matched the curve of tooth roots with unsettling accuracy. Someone designed these tools through extensive trial and error, which means they practiced on living patients. The knowledge accumulating over generations. Think about that for a moment. These practitioners understood anatomy that European doctors would not rediscover until the Renaissance. They knew which nerves to avoid, which roots required different extraction angles. Everything I have told you so far is just the foundation. Here is where the mystery deepens. Into something that kept researchers awake at night. In 2004, a team of Italian archaeologists made a discovery that changed everything. They found an Etruscan dental bridge with something unprecedented. The replacement tooth was not human. It was not ox bone. It was a gold tooth, solid gold, shaped to match the missing original with millimeter precision. And here is what nobody could explain. The gold tooth showed integration with the surrounding tissue. Microscopic analysis revealed patterns suggesting the gum had grown around this prosthetic, accepting it like natural tissue accepts a transplant. Modern dental implants achieved this through titanium and decades of materials science. The Etruscans achieved it with gold, 2,500 years earlier. If you are still here, subscribe now, because what comes next reveals how they actually pulled this off. The breakthrough came from an unexpected source. A materials scientist studying ancient metallurgy realized everyone had been asking the wrong question. Scientists kept asking how did they do it. The right question was what did they know about gold that we forgot. Here is the answer. Pure gold, 24-karat gold, has a property that no other metal shares. It is biocompatible. The human body does not reject it. It does not corrode. It does not trigger immune responses. The Etruscans somehow discovered this through observation. They noticed that gold jewelry worn against skin for decades never caused problems. They tested gold in wounds. They experimented. And through generations of careful documentation, they identified gold as the only metal suitable for permanent placement in the human mouth. Modern dentistry rediscovered this in the 1920s. The Etruscans knew it before Rome existed. Drop your prediction in the comments. Did the Etruscans discover this through luck, or systematic experimentation? Now here is the revelation that ties everything together. In 2019, a research team used micro-CT scanning to analyze 17 Etruscan dental appliances. What they found solved the century-old mystery. The gold bands were not simply wrapped around teeth. They were custom-fitted using a technique we now call lost wax casting. The Etruscans made wax impressions of the patient's mouth, exact molds of each tooth. They used these impressions to cast gold bands that fit like a second skin. This is the same technique modern jewelers use for custom rings. The same technique precision engineers use for aerospace components. And the Etruscans perfected it for dental surgery 2,500 years ago. The CT scans revealed something else. Tool marks inside the bands showed consistent techniques across different workshops, different cities, different centuries. This was not random genius. This was a systematically taught medical tradition, passed down through organized schools. So what happened to this knowledge? When Rome conquered Etruscan territory, they absorbed the people but not the specialized medical traditions. The dental schools closed. The practitioners scattered. Within 2 generations, the techniques were lost. Roman texts mention Etruscan dental work with admiration but never explain the methods. By the time of the Roman Empire, this precision dental surgery had become legend, then myth, then forgotten entirely. For 1,500 years, Europeans pulled rotting teeth with pliers and hoped for the best. The sophisticated replacement techniques pioneered by the Etruscans would not resurface until the 1800s. And even then, it took another century before we matched their precision. Think about that. Knowledge can be lost. Entire fields of expertise can vanish within a generation. The Etruscans achieved something remarkable, and we almost forgot they existed. What other ancient achievements remain buried, waiting for the right questions to be asked? The evidence tells us something profound about human capability. The Etruscans did not have modern technology. They did not have microscopes or X-rays or computer modeling. What they had was patience, observation, and generations of accumulated knowledge. They watched what worked. They documented what failed. They refined their techniques through thousands of procedures until they achieved something that still impresses modern specialists. This is not a story about ancient people being smarter than us. It is a story about what humans can accomplish when knowledge is preserved and built upon systematically. The Etruscans created dental bridges that lasted longer than some modern appliances. They developed surgical techniques that minimized infection without understanding germ theory. They identified biocompatible materials through empirical observation alone. Every assumption that ancient peoples were primitive compared to us deserves scrutiny. The evidence is in museum cases around the world, gold bands that still gleam after 25 centuries. Here is what stays with me about this investigation. Somewhere around 500 BCE, an Etruscan patient sat in a workshop, nervous, probably in pain. A practitioner examined their mouth, made careful impressions in wax, and promised them something revolutionary. Days later, that patient walked out with gold teeth that would outlast their